Welcome back, everybody, to another week of the Rev MD podcast. This week, I'm excited to give a few announcements. We are going to kick off a billing mastermind starting January 15th, where we're really going to start educating our physicians and healthcare providers out there who are our listeners on all the things regarding medical billing. Everything from medical billing process and just the ins and outs of what it takes to get a claim submitted, to tips and tricks with AR, to what is AR, right? What is accounts receivable? I know that some of our listeners, you guys are learning that. Some of our listeners are residents, and we all know that the medical education we get is just not enough for the business side of medicine. So we are here to start changing that. So the business side of medicine and our billing mastermind will kick off January 15th. You can go to National Revenue Consulting and click on the billing education in order to sign up. Again, we're going to basically do a different topic every month. We're going to spend an hour, maybe 30 minutes, where we're going to talk about a specific topic, and then 30 minutes where we're going to go over questions and answers and really make this kind of a group effort. This is something that's free of charge, no cost to anybody. My only request is that you invite 5 physicians or healthcare providers that you know, forward them the email, send them the link, make sure that they are ready to join as well. We are going to be recording the sessions, so if you aren't able to make it, but you're on our list, we will make sure to get those out to everyone. All right, back to this week's topic. So, why insurance verification matters. This is one of the most basic steps within the medical billing process, but I'm going to have to tell you, it is one of the things that we see practices think that they either don't need to do, or, hey, I checked with the patient and they said their insurance didn't change, and so they think and hope that that's enough. I'm going to dispel those rumors. We're going to talk about what is eligibility verification, what is insurance verification, why it matters, so that everybody can walk away with some to-dos to make some changes in their practice. It is January of a new year. We are not going to let a single dollar go by within our practices that could be ours to have, especially money that you guys earned, right? You saw the patients. You deserve to get when you have an efficient billing process, and that includes the front office process. So, first things first, what is insurance verification? So this is the process of really understanding 2 different things: the patient's eligibility with their insurance, and then also the coverage of their insurance. And so this is really simple, right? It's checking a patient's insurance to make sure it's active, it's accurate, and also finding out what a patient may owe you in terms of copays and deductibles and coinsurance. And this is really the time of year, right, that a lot of those amounts reset. And so it's a perfect opportunity for you to sit down with your front office staff, really have them educated to what insurance verification and eligibility really means, why it's important, and then also educating our patients, right? So if we educate our patients about what a copay, deductible, coinsurance really is, then they're going to be more likely to pay you. And if you missed last week's episode, I did announce that we do have some new patient pamphlets and cards that help educate patients in regards to what does it mean to have a copay or deductible, and how do I provide patients the information on what their own copay and deductible is, and give them some walkaway materials so that they can read it when they get home, they can digest it, and the next time they come into a visit, they understand it. They're, gosh, I know I've got to pay my copay. How do I get that to you? So these are going to be some things that are available on our website, National Revenue Consulting. You can click on the More button and go straight to patient pamphlets, and those will be there. They ship directly from the printing office, and we also are going to have some electronic versions of those down the line. So patient eligibility verification, this is really looking at, is the patient's demographic data current? Is it correct on the insurance identification card? And are the required, copays and deductibles paid for? Do they have an active insurance policy? Is it valid on the date of service that they're in the office? And everything that you can understand regarding prior authorizations. Do they need a prior auth for certain CPT codes? And making sure that those are taken care of ahead of time. The best time to do this, the insurance verification, is really 1 to 2 days prior to when that patient comes into the office. Of course, if you've got a new patient, you can do that immediately while you're registering. You can check into your practice management software. Oftentimes, a lot of those have a button you can push and say, hey, I want to check their patient's insurance eligibility, and it'll provide a lot of this information right in front of you. So you can do that, again, while you're registering the patient, or ideally, repeatedly 1 to 2 days before any patient is seen in the office. Now, other things that you're looking for is the service you're providing covered in the patient's plan? And who is the subscriber? Right? Is it the patient or is it a spouse? Because you'll want to have all of that information documented within the patient's chart and within the billing system so that those claims get submitted appropriately and they're not rejected. You're also going to find out, of course, do you even accept their payer? Do you even accept their plan? This is a really important part, especially now with the No Surprises Act. You want to know if that patient is in or out of network so that they can understand what their cost may be and that you can give them a reliable estimate up front. Of course, understanding primary or secondary insurance coverage. And this is a big one. Patients don't really understand this, to be honest. I think they say, well, I've got, Medicare, or I've got this or that and the other, but they don't recognize that they may be covered, but that may be a secondary insurance. And so you could be submitting claims to where you think is their primary, but in reality, it's their secondary. And that's, again, going to cause rejections. It's going to cause increased AR, denials, et cetera. So really, this is the most basic function of your office, the most basic element of medical billing, but you got to do it. Insurance eligibility verification needs to be part of your process. Typically, this is handled by the front office because you're the ones who registering the patient and, checking everybody in. And you're also the one typically communicating with the patient to say, hey, well, on your visit, you're going to have a copay. It's $20. Be prepared to pay that up front because we do accept and, take copays, coinsurance, and deductibles up front. You're going to want to have all of that information really at the hands of your front office. And the more your front office understands this process and understands the why, the better they're going to be able to communicate to your patients to say, hey, this is due today before you see the doctor. This is why, this is what it means. And that's going to help keep your patient AR down. So again, eligibility verification is something that helps keep your patient AR down and your insurance AR down. And we're going to talk a little bit about that. So what can happen if you aren't checking insurance verification beforehand? And we're going to go through 5 things that really can happen if you aren't doing this well in your office today. So number 1, like I mentioned, patients aren't able to pay an accurate amount upfront in the office. So think about it this way. If your office isn't checking the eligibility, that means the patients show up, they check in, and either the front office isn't confirming what amount they should be paying as part of their visit, or they're just ignoring it altogether. This typically results in more patients needing a patient statement, higher patient statement amounts, and depending on how often you're sending out patient statements, that's also going to mean larger patient accounts receivable and a longer time for you to get paid. So this all is connected. Patient statements may end up getting unpaid, especially if you're just billing out a $5 or $10 copay that just tends to get forgotten. So again, that $5 or $10 copay that doesn't end up getting paid adds up over time. So at the end of this, making sure that you have the eligibility process to tell you copay, deductible, coinsurance is going to help you improve your bottom line. Number 2, the next thing that can happen is the insurance can be inactive. So obviously you're going to be losing an opportunity while the patient is checking in to get that accurate insurance card. So if you're checking eligibility up front, then you're able to wave that patient down as they're checking in, go, hey, I noticed that your insurance coverage lapsed. Do you have a new insurance card? Because your system is telling you, hey, this last one, is not accurate, or it's lapsed, or it's not active. Then you can help start a new insurance verification when they're checking in, grab that new card, make sure that's documented in the system so that when you go to submit the bill or the claim, you're not having to wait for a rejection or a denial, letting you know, hey, that coverage isn't active, that patient isn't eligible. So then you spend more time trying to chase down a patient, go, hey, now you're having to call patients, ask for an insurance card, trying to get that, through the mail, playing phone tag. All of that could be avoided by just pushing a button, getting the verification ahead of time. If there's an issue, asking the patient when they're visiting, or even calling them ahead of time to say, hey, what's going on? Can we get that new information? And then you're all set up, and that's going to streamline your process in the office. The other thing to call out, and I'm going to give it a number 3 because it deserves its own call out, is that you could be submitting claims to the wrong payer. I cannot tell you enough of when I'm reviewing AR and denial reports with our own billing team, how often this happens. So if you aren't catching that, they say that their primary is one payer, but really that's their secondary, then you're billing the wrong payer. And then you have issues where you're submitting claims, they're getting rejected, they're getting denied. If your billing team's not staying on top of their AR, then that is right there is going to just pile up, and then it's going to make it so much more challenging to correct for that. And depending on how good your billing team is, you may then end up dealing with old AR that's past timely filing, and you've lost that money. So again, it's very critical that you're billing to the right payer, and you really only know that if you're doing the eligibility verification. You're documenting that they're eligible, that it's active, that you know that the activities or the part of the visits, the procedures that you're doing in that office, that visit, are truly going to be covered by that patient's plan. Now, number 4, if you're checking eligibility up front, this also gives you an opportunity to see if it's a patient's insurance you accept, right? Because you may not accept that plan. You may accept that payer, but you may not accept that plan. And so if you know that ahead of time, you can call and let the patient know if it's past registration or if they've changed plans. Let them know that they may be out of network, and here's the cost of what that could be. There's no surprises. Patients are happier. Office staff are happier. You're dealing with that ahead of time. You're not dealing with that while other patients are waiting in line trying to get seen and get checked in. And that brings me to number 5. One of the most common complaints a doctor's office gets is that they have to wait too long to be seen by the physician. There are a number of reasons for this, and we're not going to go into that today, although that would make a good podcast. But if your office is checking insurance eligibility while the patient is checking in, that can sometimes be a 10-minute process, right? Especially if your practice management software, your billing software doesn't have that little button where you can just check eligibility. They have to go and sign onto a payer portal, and, it just slows everything down. Now, if you're able to do that in your EMR or do that ahead of time in one of the patient portals, then you can do that 24 to 48 hours ahead of time, and it's going to improve your check-in process. So again, you really want to focus on insurance verification because it's going to allow you to understand what the patients owe when they show up. It's going to allow you to get any information that does need to be corrected dealt with when the patient is either on the phone ahead of time or in the office when they're checking in, so you don't miss that opportunity of getting that stuff corrected before a patient visit. You're going to be able to keep your insurance and your patient AR bucket low. And it's also going to make sure that you are complying with any of the No Surprises Act when it comes to having an out-of-network patient. Again, lots and lots of reasons of why you should be doing this ahead of time. And again, to me, one of the most important things is it improves your whole process as that patient's checking in. It's just a better experience for both your front office staff and your patients. So now that we've talked about why it's important to verify patients' insurance, let's talk a little bit about the options on how to do this. Essentially, the most basic premise is that you're taking the insurance subscriber's information, right? The member's name and subscriber ID, and you're verifying it with the insurance provider. Now, there's some easy ways to do this and some more time-consuming ways to do this, and this really all depends on your software. The most difficult is to call the insurance company directly. Nobody wants to be doing this. If your office staff is having to do this for the majority of your insurance companies, we've got a problem. You need a new software, period, end of story. This really should be part of your practice management and or billing software, depending on how you've set it up. So I really highly recommend that if that's not a feature within your system, that we need to start looking for other softwares. And I know that's a painful realization, but again, all of this stuff adds up to time and money, whether it's your staff or lost efficiencies in your billing process. So again, most time consuming, calling insurance directly, talking to a live agent, verifying insurance manually, not a mechanism I recommend unless you absolutely have to. And there's a few insurance companies that are a pain and they don't have the portals and all the things that make it easy, but that should be the minority of what your team is doing. The other option is to go directly to the insurance portal and verify it electronically through their system. Again, not the easiest way to do it, but certainly a very efficient way. If you're kind of grouping your patients, by payer, if you're using portals that have multiple insurance companies on them, that's all a way for you to verify insurance in an easier way. Like I said, the most efficient way is to work through your EMR or practice management software, depending on who you're using. That's typically a feature. Sometimes it's an add-on feature that you have to pay for. It shouldn't be very expensive and is well worth the money. So again, ideally, you're doing this insurance verification a day or two ahead of time. Anytime you register a new patient, you're doing that at the time of patient registration, meaning they're calling and saying, "Hey, I'm a new patient, and I'd like to come and be a patient in your practice," and you're collecting that insurance information in that first phone call. You're checking eligibility as you're registering them. Because again, ideally, this is in your EMR PM software where you're registering the patient. It's all streamlined, it's seamless. That is the ideal state. It's important for your office staff to really understand the most efficient way to do this, to make it part of their process. Get your SOP on registering patients written out so that new staff can be trained on this. This should not be, something that you're guessing at. This should be part of your policies and procedures. And I think I'm going to do a podcast on that later this month. If you haven't heard of Dr. Una with the Entree MD podcast, she's incredible. She gives lots of tips on making protocols and basically systems for your business. And I have to say, I've been a huge fan of her and really enjoy the stuff that she's teaching, me and other, physician entrepreneurs. And so really highly recommend that. What I'm talking about today is not just something you walk away and go, okay, yeah, I'll talk to the front office staff. I want you to walk away and go, okay, here's the reasons why that I need to be doing this. And here's the tips I'm going to talk to my front office staff. We're going to educate, everybody in the front office on why this is important. We're going to understand our options of how to get this done. And we're going to make this as part of our standard operating procedures within our front office process. And that's end of story. Right? This is, not hard, but it does need to be done. All right. I promise that's it for today. Hopefully you guys are walking away with some to-dos and we're starting off January. As always, if you guys are looking for a new billing team, now is the perfect time to make a change. We really help clients walk through the transition process so that you understand, hey, this is what it's going to take. This is what the process is going to look like as we transition. We provide our clients with data every month so that they walk away going, I know where my revenue is and I know how we're going to grow it this month. Again, reach out, info@nationalrevenueconsulting.com. And I hope you enjoyed this podcast. We look forward to seeing you guys all on July 15th, 9 a.m. Mountain Standard Time. We're going to do our first billing mastermind where we're going to talk about exciting topics, education, so that all of our physicians and healthcare providers know everything that they need to know with regards to medical billing so that your practice can thrive. All right, talk to you next week.